we may or may not know if we're going to put the Reboa catheter in, but if we're concerned about that, then we may want to get access into the femoral artery using a femoral arterial line kit. This is available outside the trauma room and contains everything we need to put that kit in. And this will also be put in under direct ultrasound guidance. So you not only need this kit, but the ultrasound and a sterile probe cover so that we can continue to have a sterile environment. All right, let's start with a femoral art line.
Got it.
Gave you one from yesterday to finish, and that's enough.
All right, and we're going to need the ultrasound to put this line in.
Sure, I'll get the ultrasound.
Okay, we're going to have to put the Reboa in, so let's get the Reboa kits in the room as soon as we can.
Reboa kit coming.
So if the patient deteriorates and they have the arterial line in place, we can then decide to upgrade that to the 7 French catheter that's necessary to put the Reboa catheter in. The 7 French catheter is located in this bin, and it's a convenient set that's made for the Reboa catheter, and this will allow us to upsize from the A-line, or if we don't have an A-line, we can just use this directly to put our 7 French catheter kit in. Once you have access to the femoral artery, your next step is to measure to see how far you're going to put your Reboa catheter in. If you're going to be in zone 1, then you want to measure to the sternal notch. If you're going to be in zone 3, then you're going to measure to the tip of the xiphoid. If you look at the Reboa catheter, there are measurements on the Reboa catheter that you can utilize, and you can hold up with your hand down at the groin, and if I'm going in zone 1, I put the tip of the catheter at the sternal notch and take my reading, and this is exactly 48 centimeters. If I'm going to go in zone 3, then I put the tip of the catheter at the sternal, or at the xiphoid process, and I look down, and this is at 24 centimeters. Once you have that measured, you can verify with the numbers on the wall. I can get that out. Again, they show that the approximate depth for zone 1 is 46 centimeters, and the approximate depth for zone 3 is approximately 28 centimeters. The next step is to flush and deflate the balloon. If you look at the catheter, the balloon is exposed, and the balloon port is very visible with a label that says balloon. You'll put your syringe on there with some saline, and you'll flush the balloon and then suck that out and make sure we're back to a completely deflated balloon. The next step is we have to cover the balloon with the peel away introducer. That's the orange part that comes on the catheter. In order to get this over the balloon, you turn and advance it slowly over the balloon, and that will protect the balloon when you're inserting it into the femoral catheter. Once you have the balloon covered, you continue to advance the orange part until the curly tip of the catheter is completely covered. That allows you to insert this safely into the pre-placed 7 French sheath. The next step is to attach and flush the arterial line. It's clearly labeled with a pre-placed stopcock on the arterial line port, and the nurse will help to insert the arterial line. This gets flushed and all air gets purged from the system. We're now ready to insert the Reboa catheter. You'll start by inserting the catheter into the femoral sheath that you've already placed. Once that catheter is into the femoral sheath, you can continue to advance until the catheter is in the femoral artery itself. And at that point, you'll hold the orange peel away part of the catheter and continue to advance the actual blue Reboa catheter. Once you advance the blue Reboa catheter so that the balloon is in the blood vessel, you can then grab the ends of the peel away catheter and peel that orange catheter completely out of the system. At this point, you're ready to advance the catheter to the appropriate zone. Remember, if you're going to zone 1 or zone 3, you will use your measurements that you made on the patient to advance it to that point. And again, you will refer to the centimeter marks on the actual catheter and where that protrudes from your 7 French catheter that's in the femoral artery. Remember, for your balloon port, which is again labeled balloon, you're going to have a large syringe attached to that. In the syringe, 5 cc's of contrast mixed with 20 to 30 cc's of saline. The contrast will allow you to see the balloon once it's inflated to assure that you are in the proper position, and this can be confirmed on X-ray. Once you've got your balloon advanced to the appropriate location, you're now ready to inflate your balloon. If you're going to zone 1, the aorta is bigger, so you need approximately 8 cc's of inflation to get it to completely occlude the aorta. If you're down in zone 3, you may only need roughly 2 cc's of injection in order to get appropriate occlusion. As you're inflating the balloon, you need to keep your eye on the arterial waveform, and you should be able to see a complete change in the waveform once you have occlusion of the aorta, and that lets you know that you have the appropriate amount of inflation. The last step is, if you have achieved appropriate blood pressure control and hemorrhage control with the inflation of the balloon, you can secure this catheter to the skin and to the 7 French introducer to make sure that it doesn't move. Of course, the final step of any Reboa catheter placement is to achieve definitive hemorrhage control. Once your balloon is up, you have a limited amount of time to achieve that control. These patients should be either ready to fly to a level 1 trauma center or be ready to go into the operating room immediately to achieve appropriate definitive hemorrhage control.